Do you ever feel like you need a PhD just to understand your health insurance plan? You're not alone. Most Americans feel completely lost when it comes to health insurance. With terms like copay, premium, coinsurance, deductible, out-of-pocket maximum, it can often feel like you're learning a new language, but the cost of mistranslating could be thousands of dollars. It's no wonder a lot of us just tune out and pick a plan we don't understand. But not you anymore, because today we're going to review who pays for your care and when, and walk through key terms to help you stay insured and informed. Hey, I'm Shamy. I'm a healthcare finance professional and your go-to girl for health insurance and policy breakdowns. So if you want to learn how to pick a plan or read a bill or just figure out what all of these health headlines actually mean for you, please subscribe to this channel, like this video, and leave a comment down below. Let's start off with what a premium is. A premium is the cost of your health insurance plan or the cost of gaining access to benefits. Think of a premium as a membership cost. So most of us, including myself, have an Amazon Prime membership. And what that gets you is discounted prices on certain items. It also gets you 2-day shipping and access to Amazon videos and TV shows. While your health insurance premium is similar, it's the cost you pay to be a member of your health insurance plan. And you get certain benefits from that, including discounted rates on your doctor's services, your health insurance paying for some of those services, and preventative services, which include things like annual checkups, certain screenings, and vaccinations aimed at early detection and prevention. Check out a link in the description for a list of preventative services covered by most health insurance plans. Now, what happens when you're sick and have a problem you need to see a doctor about? Who pays for your care and when? Well, there are 3 steps to answering this question, and the first one is you pay for your care until you reach your deductible. A deductible is the amount you pay for out of pocket to your doctor before your health insurance company starts paying for anything. And these include costs like hospital services, doctor's visits, visits to the ER or urgent care, surgery, lab and imaging costs, and even prescription drug costs, assuming your health plan doesn't have a separate deductible for that. If you want to figure out what your specific deductible is, or other amounts you have to pay in your plan, such as a copay, coinsurance, out-of-pocket maximum, all terms we'll cover on later in this video, please log into your health insurance company's member portal and search for a document called the Summary of Benefits and Coverage. Let's go back to the Amazon Prime analogy. So after you pay your membership cost, you still have to pay the seller for items you want to buy on their page. In healthcare, these are like your out-of-pocket expenses, of which the first is your deductible. Let's walk through an example together. Say you have a plan with a $500 deductible. Now it's New Year's, you're on a health kick, and you're going to see your doctor about that knee pain or whatever problem you've been putting off. You're going to take care of it this year. So you go and see your doctor and they send you a bill for $300. Now, because you have not met your deductible yet, you are responsible for paying for that $300 in full. And you will be responsible for continuing to pay for your medical care in full until you reach that $500 deductible. A lot of people confuse the terms premium and deductible for one another, so let's recap them before we move on. A premium is a membership cost you pay to your health insurance company, and what that gets you access to is preventative services. A deductible, on the other hand, is the cost you pay for healthcare services to your doctor, and you will pay for these in full until you reach your deductible. Well, what happens once you've met your deductible? Who pays for your care then? Well, that's step 2, which is you and your health insurance company pay for the cost of your care. The portion of the bill you're responsible for paying is called a copay or coinsurance. A copay is a flat fee, while a coinsurance is the percentage of the bill that you're responsible for paying. Let's walk through a couple of examples to show how this would work. So let's say it's March and you've met your deductible, but you now have a nasty case of the allergies and you need to see your allergist.
I'm sick.
Your copay is $50. So when your allergist bills you $400 for his services, you're only responsible for paying $50, while your health insurance plan will pay for the other $350. Nice, right? But let's say it's the weekend and you can't get a hold of your allergist, so you go to the urgent care instead. Your urgent care coinsurance is 20%. So when your provider sends you a $600 bill, you're only responsible for $120, while your health insurance pays for the other $480. I know what you're thinking. When does this stop? Will I ever be done paying? Isn't this the whole point of health insurance? Well, the answer is yes. And the next step is step 3, when your plan pays for it all. An out-of-pocket limit is the maximum you're allowed to pay for your care before your health insurance company pays for the rest. And it includes things like your deductible, copay, and coinsurance. Note that it does not include your premium. Let's walk through an example together. Say you have a $2,500 out-of-pocket limit, and so far you've paid $500 for your deductible, $50 in copay, and a $120 coinsurance, or $670 out of pocket so far, which means you'd have to spend another $1,830 in copay and coinsurance before you hit your out-of-pocket limit. But once you do, your health insurance company pays for 100% of your care afterwards in that plan year. Note that this goes on until January 1st, or whenever your plan year resets, at which point you will have to meet your deductible again. If you learned something new today or still have questions, I'd love to hear from you in the comments. And if you like breakdowns like this, please be sure to subscribe to this channel and like this video. Thank you for watching, and I'll see you next time.